Hello, everyone, and thank you for joining us. You're here for our webinar, Achieving Optimal Nurse Staffing Levels in Emergency Departments, hosted by ShiftWizard. I'm here with co-founder and chief nursing officer of ShiftWizard, Shane Parker, as well as Ed Keating, the clinical program manager of WakeMed Health Hospitals. We're going to begin the webinar in just a moment, but first I'd like to call out a couple notes. We're going to be accepting questions through the GoToWebinar interface throughout the presentation. The presentation will last 30 minutes and we'll save 15 minutes for question and answering. We'll also be posting any answers to questions that we're unable to get to on our blog after the webinar. So with that said, I'd like to turn over the mic to Shane and Ed.
Hey, good afternoon, everyone, and thanks for joining us. This is Shane Parker, as Matthew said, the co-founder and chief nursing officer for ShiftWizard. A little bit about my background. I was an emergency department nurse for 10 years, and after that I went to critical care transport for roughly 4 years, and for the past 3 years I've sat on the ANA advisory board for workforce management up in Washington, D.C. Myself and Christian Pardue, my business partner, started ShiftWizard back in 2006. We were both emergency department nurses working together at WakeMed, kind of frustrated with the way staffing and scheduling was handled, and thought to ourselves, there's got to be a better way to do this. So roughly around 2010, we were both able to focus on ShiftWizard full time. We now have roughly 70 locations across the country that use ShiftWizard to manage their staffing, scheduling, and productivity needs. Ed?
And my name is Ed Keating, and I am a clinical program manager at WakeMed Health Hospitals. That's a relatively new position for me. For the last 10 years, I've worked in emergency services at WakeMed, first as a staff nurse, then as a supervisor educator. I was manager of 2 of their 7 emergency departments. And when I was a supervisor educator, my main project was department productivity and using this hours per patient visit model that our finance departments have pressed us to use, and trying to figure out how to achieve that target by giving real-time information to our charge nurses. So that's where I came to this project from.
So why bother with productivity data? The simple answer is probably because you're being forced to. As Ed just mentioned, it was obviously a large initiative for WakeMed, and productivity is obviously important. Today, myself and Ed will discuss productivity measurements with you and show you some tools to more effectively manage your productivity and your staffing within the emergency department. Additionally, better processes around staffing related to productivity lead to nurse satisfaction, staff satisfaction, as well as reduced medical errors. So small decisions can make a big impact on an emergency department's budget. They can impact the budget in a good way or in a bad way with savings or losses. Losses can especially occur when a department is using manual methods to measure their productivity. As you all know, manual methods are ineffective and very time-consuming, especially to team leaders, managers, charge nurses. ShiftWizard allows for full transparent productivity in real time from the department level to the enterprise level. In order to make this happen, integration is key, and integration with time and attendance and EMRs are very important for the productivity to work well.
So I think the beauty of this system is that it's taking all the data that you're already keeping track of. So instead of having to go and find information and enter it into a spreadsheet or something and coming up with a total, you've already created a schedule, and so it's able to read your schedule. It's able to know how many people you have working, and if you send somebody home, you already are marking that somewhere, and it's taking those hours out of your productive time. As well as getting your patient feed, your ADT data, your arrivals and discharges every hour. So it is as close to real time and seamless, painless, no user input needed, other than stuff that you're already keeping track of for different reasons. And it's just applying that and showing it to you in real time It's an amazing tool as someone who created a manual system and taught 30 or 40 charge nurses how to use it. This is an incredible improvement over that process. It's just clean, simple, easy, and there.
And I'll add too, real quickly. You know, WakeMed has been instrumental in helping ShiftWizard develop a lot of our productivity reporting methods and measurements and all, and we'll talk about that a little bit later on. So electronic staff scheduling systems, these are vital to emergency departments, especially given how difficult an emergency department scheduling process can be. I mean, the two big keys here are integration, as I mentioned just a minute ago, and then adoption. Adoption is extremely important for an electronic staff scheduling system to work. Staff scheduling has always been sort of a touchy point for nurses and for staff, and you want to make sure your staff are happy at the same time covering, you know, the needs of your department. If you don't have a scheduling solution that's easy to use, such as ShiftWizard, which the staff adopt to very well, then you know, you might as well go back to a manual scheduling process.
So the other thing that this lets you do is look at your historic data, and you can see the graph on the right is showing a department's productivity, the major points that can be impacted are displayed, and so you can look at today, but you can also look at yesterday, last week, last month, and see where you've been and hopefully where you're going.
So the next slide, just briefly, we'll hit on what WakeMed was able to do with an implementation of ShiftWizard. So through our implementation there at WakeMed, with the utilization of productivity with the integration, WakeMed was able to see significant ROI, as you can see from this slide. A lot of this was accomplished by reallocation of resources used to reduce overtime and agency usage. One of the big things we did for WakeMed was to develop a supplemental staffing pool module, if you will, or a float pool module. WakeMed currently has 7 EDs across Wake County, and the supplemental staffing pool is now able to look across the enterprise, not just the EDs, but every department within the hospital. But they can look across the enterprise. They can see where all the open shifts are, and they can make decisions to either float people, or they can take some of their supplemental staff and put them in those departments or those emergency rooms that are short-staffed. I'll let Ed speak a little bit more in detail about this. So, you know, he can talk about how they were able to see the ROI here.
Mm-hmm. Yeah. So this was an initiative that was driven partly through our staffing pool and our clinical administration unit, where they aggressively targeted overtime and worked to reallocate resources across departments. We've recently adopted a program they call Happy to Help, where if you're a nurse who's interested in being floated and is willing to get oriented to other departments, you can go get that training and receive a bonus if you're for that shift, if you're able to be reallocated to another department, or signing up as just an on-call person for the float pool at a higher rate if you're needed. So that's been pretty popular. And the initial days, honestly, the reallocation without that was less popular, but it was about a 300% return on investment in the first year that we did this. That we were able to achieve in cost reduction just in overtime. So if you know, it wasn't that we didn't have enough people, we didn't have them in the right places, and so we were able to help the units that were struggling with the units that were doing okay, and reduce that overtime usage. It was hugely successful.
So we'll talk about productivity now. So integration is key. ShiftWizard integrates with your time and attendance solution, whether it be Kronos, ADP, or some other solution, and as well it integrates with your EMR solutions, so Epic, Cerner, McKesson, any of those. Those integrations are key to making productivity work and allowing the solution to be transparent and show you where your needs are and show you how your productivity is running throughout the day. During an initial implementation of ShiftWizard, we'll sit down with each manager and gather multiple pieces of data which are entered into ShiftWizard and become the foundation of the productivity measurements. ShiftWizard is configurable for each organization, so you may do your productivity a little different than another hospital, and we're able to accommodate that. Saying that, when we have that foundation built, we start pushing out productivity. It allows for real-time data such as your worked hours per unit of service, or in an emergency department it would be your HPPV. To be calculated and presented to your team leaders, your charge nurses, your managers. It allows them to proactively make staffing decisions to help with your budget and manage that productivity.
Yeah, the productivity dashboards are a crucial part of this, and what that does is shows the charge nurse. The charge nurse that comes in, and the first thing that they see is the number of patients that they need for today. So if I average 200 patients a day, and I come in and it tells me I need 225 patients to make my numbers based on how I'm staffed, I know that I've got a heavy staff load, and if it doesn't look like I'm on track for 225 patients, I've got to fix that. And so it gives the clinicians the information that they need in a way that they can relate to it and act on it. And it's worked extremely well in our emergency departments. When we started paying attention to this, we were able to go 3 or 4 years before we went a pay period that we were over our target. Part of that was the nature of the business and being busier than we were staffed, but we did, when things slowed down, we did respond to it. Another beautiful thing it shows is, maybe if I come in and I'm only at 90% of my productivity, which means I had more staff than I had patients, I can also see how much flexing and floating went on. Sometimes that's going to happen. You're going to be at a lower productivity. But if I look and I see my charge nurses responding to that, and they were at least flexing some, I know that they're trying. Versus if they didn't do anything and they just had that beautiful day where everybody sat around playing Uno like in the good old days of emergency departments late at night. And we don't have Uno games anymore in emergency departments, and I suspect that you don't either. But we used to, and we used to keep our staff on just in case, and so now we're a much more responsive and dynamic. And so here you can see the budgeted visits for the day of this department is 91. They're at 94% of their productivity, so they're a little heavily staffed. They've had 43 visits so far today. They're running at 2.98 on their daily HPPV against a target of 2.79. The hours and the variance hours, just more information for the clinician, and then how many hours have we flexed. So there, in a nutshell, on every manager's dashboard is how their department's doing today, and with one click they could get into that big report that you see behind it and look at any one of those markers on any one of those days in perpetuity for as long as you've had ShiftWizard running and integrated into your system. So just simple, easy. It takes all the stuff that you're doing already and gives you the information that you need.
Yeah, so as you can see, as we spoke about earlier, we pull these numbers hourly, your visits hourly, and we match that up with your staffing matrix on the back end of the system and provide you with this data. Each department's a little bit different. Each ER is a little bit different, but typically they're looking at this, in near real time. Some emergency departments are making staffing decisions as often as every couple hours. Some of them are making staffing decisions, roughly every 6 hours or 8 hours. It just all depends on the department itself.
Yeah, we do, at WakeMed we have big departments and we have little departments, and so I would say our big department is probably making those decisions constantly, where the smaller departments are looking at it more, maybe 3 or 4 times a day. But it all depends on what kind of department and what's happening with it. how you utilize it.
All right. Thank you, Ed and Shane. Really appreciate your insights. We'd now like to move to the question and answers portion of the webinar. So you can find the question feature within the GoToWebinar interface and submit your questions via text, and I'll read off the questions, and then Ed and Shane will give their answers. So I have a question to start off here. How often are you making staffing changes based on the productivity presented?
So yeah, that depends on your department, I think. Again, you know, in our main campus adult ED, we go from starting out with maybe 18 or 20 nurses at 3 a.m. and 7 a.m. and at 11 we bring in 4 or 5. At 3 we bring, I think at 1 they bring in a few, and then at 3 they bring in even more. So we go up to a peak of almost 30 nurses, and we have people coming and going almost every 2 to 4 hours. And so as we're looking at knowing, you know, A, how many patients you need for the day, how many you've gotten so far, looking at those over time also helps you pick patterns. And so if you look at it every day at noon, and your HPPV is a certain number, or your daily visits are a certain number, you get to feeling like, is this a big day or is this a slower day? And so they look at it as people are coming in for opportunities. If they know that they're needing to reduce, it looks like, to get to their number by the end of the day. So they're looking for opportunities to shave an hour off the beginning or end of somebody's shift to help make that happen. So it could be as much or as little. In our adult ED, our charge nurse actually has an assistant, because the charge nurse is so locked to the computer and the phone to do the things that they need to do, that we have another charge nurse who basically runs around and puts out fires and takes care of things. And so our charge nurse has ShiftWizard open constantly, as they're just adjusting, you know, people calling out sick, all the things that happen. We document all that within the ShiftWizard system, and then it actually helps integrate with Kronos, and so information flows both directions from Kronos and from Epic, our EMR, and they interface with it through ShiftWizard, which is kind of a cool feature.
Yeah, and I would agree with Ed on that. Although he's obviously the specialist here, but based on what we've seen with our clients, it really depends on the size of the ED. You know, as Ed said, larger EDs are level 1 trauma center, big ED. You know, they're looking at this thing constantly. Some of your smaller community hospitals, you know, will look at it every 4 to 6 hours. So it's really just dependent on the size of your emergency department.
All right, we have another question. How receptive have staff been to the flexing of staff?
So sometimes they love going home, and sometimes they hate going home. So that's pretty individualistic, I would say. You know, typically, if you want to send them home, they don't want to go, and if you need to keep them, they would like to go home. What's been more challenging, I think, is the floating and the sending people to other units. And so we've done a lot. Again, they recently pushed out this program. They call it Happy to Help, where they've incentivized that, which I think was a fabulous idea. So now, you know, we have people who would never ever want to go to another unit, but would go anywhere you asked them to for another $2 an hour, you know. And so I feel like we're on the right track with that. But you know, in general, sometimes in our big adult ED, nobody ever minds going home. And some of our smaller EDs, where we operate on a minimum staffing, and they're flexing a little bit more if their volume gets off for a period of time, people can get low on their PDOs, and that can be more of a challenge. But then the floating becomes more desirable to them as well. So you never make everybody happy all the time, but we just circle that conversation back to, you know, we have patients, they need someone to take care of them, and you're on our schedule, so you're it, tag.
And I'll say too, real quick, within ShiftWizard, with our integration to the time and attendance solutions, any employee that's either in overtime or is going to be in overtime during this pay period is highlighted in red. So, for example, as Ed was just saying, if you need to flex down for whatever reason, the charge nurse can quickly see within ShiftWizard who the employees are that are in overtime, and they can make decisions based on that as well. We also have what's called our flex log, where the charge nurse or the manager can quickly hit a button and see whose turn it is to go home, for example, if overtime is not a factor. I remember when I was nursing, and I know this is still a lot of the case in a lot of places, is that we would have a notebook at the nurse's station, and if we had to flex somebody home, we'd all run to the notebook and see whose turn it was to go home first. Within ShiftWizard, we have a flex log that takes care of all of that for you, so they can quickly hit the flex log. They can see when someone was floated last, when they were sent home last, and that log also, as I said before, includes any employees that are in overtime or expected to be in overtime, so that they can make smart decisions. I think that's key to maintaining your productivity and your overtime and all of that as well. If you're operating with a system that's giving you a report from yesterday, it's not a whole lot of help if you're getting something saying your overtime was out of range yesterday. There's obviously nothing you can do about that. But having the ability to manage that in real time and see that and have that transparency is really key, and it's been beneficial to our customers and reducing overtime.
Yeah, and you saw the graph. I mean, what it did for our overtime was tremendous, and all it really was showing us who was in overtime in real time, so that when we were making the decisions about if we were going to reduce staffing due to volume, we could send the overtime people first, and it worked fabulously.
All right, we have another question. Could you please speak more to how tracking HPPV can directly impact your staffing?
So tracking HPPV doesn't impact your staffing at all. It's you going out and changing your staffing based on the information you get that's going to impact your unit. So tracking your HPPV gives you the information to make good clinical decisions. And again, it's not always about reducing your staff either. At times, HPPV shows you when you need more staff and when you need to be asking for help from other units or from your flow pool or reallocating. So when staff and even charge nurses have come to us and be like, this is all just about flex. No, it's not. I want you to be as close as you can get to that target without going over. I don't want you to run way under your target. We want you to have the nursing staff that you need to take care of your patients, and we can argue about whether the target is right or wrong, but it is the target, and so we want to use all of that we have and whenever we can and convert that into great patient care. And so it works both ways, but tracking HPPV just gives you the information to make the decision in a way that isn't going to negatively impact your department, and to make smart decisions, I think, is the best way to say it.
And I'll agree with that. We have another question?
Yeah, we have another question here. So is there a particular size a hospital needs to be when looking to invest in an electronic staff scheduling system?
I'll take that one. No, there really isn't a particular threshold or size. In our case, we have hospitals that are critical access hospitals all the way up to large systems like WakeMed with multiple locations and level 1 trauma centers. When you take into account the amount of time that's spent doing a manual schedule, even for a small department with 15 or 20 employees, you not only take into account the time spent putting together that schedule for a 4 or 6 week period, but the day-to-day process on managing all of that. And it becomes very burdensome, especially if you're in a smaller hospital and you don't have the resources that you should have. If you're in a more rural hospital, increasing productivity, even from the manager's perspective, becomes very important. One tool that's big for our users is our communication center. So we have a communication center where, for example, if you have someone call out sick, ShiftWizard will, within a few clicks of the mouse, will automatically start calling your staff for you. It'll text them, it'll email them, and it'll send them an internal message. So, for example, if I had someone call out sick this afternoon, I could quickly go into ShiftWizard and filter out the type of person I'm looking for, the role, and the certain permissions that they need to have to work in that particular shift. And within a couple of minutes, I could send out a blast to all of my employees and let them know that I've had a call out and I need some help to cover this shift. The other piece of our communication center too, real quick, is especially given everything that's going on in Florida with the hurricane and all, we also have the disaster management feature within ShiftWizard's communication center, where if you needed to send a blast out to all of your employees saying that the inclement weather and hurricane plan has been put into place. I know here in Raleigh, whenever we get a little bit of sleet or a little bit of freezing rain, it becomes a kind of disaster for transportation. So I know that a lot of our hospitals will use it for weather as well, for weather, whatever kind of circumstance it may be.
But to Shane's point, when we did a drill 5 or 6 years ago, we did a disaster drill. The simulation was that a bomb had gone off in downtown Raleigh, and at that time our children's emergency department on our main campus had gone to ShiftWizard, but our adult emergency department had not. And so our adult emergency department, they had the list of staff, and somebody, when the disaster was declared, somebody sat down with that list and started calling each staff member. And the children's emergency department sent out a ShiftWizard text message to all of their staff. And of course, everybody knows what the hospital number looks like when they call on the phone, so nobody answers when the hospital calls. So I believe that the children's ED had gotten 20 or 25 responses before the adult ED person calling the list reached the first individual. So they were able to get the message to every children's emergency department employee, and 25 of them had responded within 5 or 10 minutes that they could come, or they couldn't come when. I think maybe they gave them an option of could you come now, could you come in 8 hours, could you come in 12 hours, and they were all able to respond when they could arrive, and they could kind of map out how their staffing was going to be in minutes, and the AED hadn't even gotten started, had reached one person at that point. So the uses of the message center are far and wide. In some departments, people use it, to communicate. I need help. Can anybody cover this shit? The staff will use it to reach out to their peers. And it's an opt-in. You don't have to get those text messages if you don't want to. And we tell people, we encourage them, but we don't require it. And if you're wanting to work and wanting to be engaged in the department and want to respond to emergencies, then we encourage you to sign up for it, but they don't have to. So it works fantastically well. It's a great tool.
And it is widely used at WakeMed, for example. They send out over, not just their ED, but their system alone sends out over 100,000 messages a month. So obviously it's well used and well liked.
All right, we have a new question. How easy is the implementation of your system, and when is productivity tracking initiated?
Yeah, so the implementation of ShiftWizard is fairly painless. We designed this thing. It was obviously designed by nurses, for nurses initially, but it works anywhere in healthcare now. So when we come in and we do an implementation, typically it depends on the size of the ER or the ED, excuse me. If it's an ED only implementation, you're looking at 4 to 6 weeks roughly. A lot of that work is done on our end. Your staff log in to ShiftWizard once we get your URL set up. They do their registration, and then we've got some videos that they watch. There's 6 videos that are roughly a minute to a minute and a half that will train your staff, your end users. For the managers and charge nurses, supervisors, we come in and we do on-site training. It's typically 2 training sessions of roughly 4 hours. It may be more, it may be less, depending on the complexity of the emergency department and the size of the emergency department. But it is a fairly painless implementation.
All right, we have a follow-up question. Is it real-time information?
Yes, it is. It's near real-time information. It's not a stream of information, but it is a near real-time information. It's really dependent on how often or how quickly the department itself wants to pull the information from, either the time and attendance solution or the EMR. Typically, what we're seeing right now is hourly. We are also in the process of developing an IoT dashboard, which will be streaming data, which will provide to the second all of the analytics that would be useful in an emergency department or a hospital as a whole. But that's how we're currently doing it.
All right, we have a final question. Will ShiftWizard be at the ENA conference next week?
Yes, we will. I think we're booth 828, if I'm not mistaken. But yeah, this is our first year attending the ENA. We're very excited about it. Me being a former nurse, I'm really stoked about going to it and looking to meet a bunch of new people and see what the ENA has to offer. I've always heard good things about the conference itself, and we're excited to be there. Come see us.
All right, that'll conclude our webinar. Thanks again to Ed and Shane for joining us. If you'd like to share a recording of this webinar with your colleagues, we will be posting the full video along with our written answers to these questions on our blog, so please keep an eye out for that. And I will also be following up with you via email with that recording. Thank you for joining us.
Thank you all.
Thank you.